All right, guys, welcome to this first training of what is planned to be a 12-month, 12 different modules covering ABA, all ins and outs of ABA. I'm so excited to be hosting this. My name is Mihala Schwartz, and I am a BCBA. I have been in the field of ABA for quite a while and have worked with well over 200 children over the years. It is an honor and a privilege to work with kids and to help them become the best that they can be and hone in on their qualities. This very first presentation is going to cover the introductions and foundations, basically the what is ABA. So if you've never heard of ABA, don't despair. This is the module for you. It's going to cover everything. I will say that during the presentation, you're not going to be able to be heard, but I do encourage you to drop questions in the Q&A. And I will spend the last 15 minutes looking through Q&A and answering as many questions as possible. Also, if you would like to share your information with us in the Q&A, I can reach out to you later on if you have more questions. But here we go. So this is Introduction and Foundations of ABA, just looking at what is it, how does it work. I wanted to first start by talking about what, in fact, is ABA. ABA is Applied Behavior Analysis. That's what it stands for. And the focus of this science is to help us understand, improve behavior. It also looks at the why a behavior happens, why it happens often, why it happens rarely, anything to do with behavior. This is what our science focuses on. It also looks at the environment and the effects of the environment, how are different things that are happening around us influencing our behavior. The number one proven strategy with ABA is what we want to do is increase the behaviors that we want to see increase. For example, a child that's in school, we want them to be able to focus on a worksheet through the completion of the worksheet. So that would be a skill that we would want to increase, the ability to attend to a less preferred task, as we call it. At the same time, our second most important focus is on reducing any kind of interfering, maladaptive, or challenging behaviors. These are behaviors like tantrums, self-injurious behavior, and other behaviors that are interfering with the child's ability to function and function in the environment of home, school, or out in the community. At the core of ABA is the idea that behavior, in fact, is learned, which means it can be changed. We can shape behavior by shaping different aspects of what happens before, during, and after, and be able to learn new ways. Think of someone that doesn't have coping skills in case they get upset about something. Well, a way to change how that person reacts with physical manifestations or yelling or screaming is to teach coping skills that then helps them deal with the feeling of anger of some sort. And that's where ABA comes in. Most of the time when we say ABA, people imagine it is just about autism, but it isn't. ABA can be used in any environment where you're dealing with human behaviors. So in just about anything. There's a huge growth now in human resources departments where we're focusing on using ABA to increase worker efficiency and productivity and the reward system being more personalized. There is BCBAs that work for the NFL, for example, and for all kinds of organizations on the spectrum. However, our main focus, obviously, and my specialization has always been in autism, working with children anywhere from the age of 2 to young adulthood at about age 25. So keeping in mind that behavior is learned, that ABA can in fact impact behaviors, that's your takeaway when you think of ABA. What is a BCBA? What am I? A BCBA is the person who helps children learn new skills, reduces challenges, behaviors, and all we do is only positive and evidence-based strategies. And when I say evidence-based strategies, these are strategies that have been tested in research and have shown either immediately or over time an improvement in the skills that we're targeting. We observe, we assess, we design personalized behavior programs to support each child's growth, and we want to make sure that whatever gains they make are gains that can be maintained, and then also what we call generalization. In other words, not just in the clinic, but also at home, in the school, and out in the community. If they're only doing it in the clinic, we're not doing our job. They've got to be able to take those gains and apply them regardless of the environment that they're in. So that is what a BCBA does. A BCBA does not diagnose autism, but a BCBA does assess the deficiencies in the three main domains that we look at, which is social, communication, and adaptive. What is it that this child should be able to do but is unable to do currently? What are behaviors that are interfering with that child's ability to perform at his best in different environments? Often I tell parents that going to school and performing in school is in fact a child's job. So we look at that as that being one of the most important environments in which they have to thrive, because those are the building blocks of them being able to make it through the educational system. But at the same time, they have to be able to be at home and engage in positive behaviors and not have those interfering negative maladaptive type behaviors such as tantrums, for example, at home. A BCBA will design the intervention that a child will have at the clinic or in home or in school. As factors change, because the BCBAs pop in at least 20% of the time that the tech is there implementing, we constantly look at the data. We constantly monitor the graphs, and we will tweak and make changes as a BCBA to make sure that our targets are keeping up with what we're seeing. So for example, you may start with a child just being able to echo words back if they're nonverbal. But as they start echoing those words back, the sounds, then we will immediately pop it up and bump it up to, okay, now we need to make word approximations. Now they need to talk in complete sentences. And all of this is done on an ongoing basis. Most of the time, we work in very close collaboration with parents, schools, if they allow us, to be able to make sure that we're all on the same page, targeting the same skills and helping that child. I talked a little bit earlier about behavior being learned, and that one of the things that we do is we look at what happens right before, which is an antecedent, the behavior itself as it's happening, and then what is the consequence of that behavior? And that is what we call the ABCs of behavior. Again, what happens right before? Think of a child tantruming at school or at home when he has to do homework. So that antecedent, that what happens before, was the child being asked to engage in a skill that he doesn't want to engage in. He don't want to do the worksheet. He's tired. He's been at school all day, and now he's going to get really, really upset and really frustrated because the demand has been placed on this child to do something he doesn't want to do. That would be the antecedent. Then the behavior itself could be that the child begins screaming, crying, throwing things off the desk, or it could be more serious where the child engages in what we call self-injurious behaviors, which are extremely serious because the child is trying to injure themselves in some way in order to not have to do what you're asking them to do. And then we look at the consequence. What happens after the child has engaged in a tantrum behavior? Is he still having to face that worksheet? Is this where the child understands that the parent is also tired and the parent is frustrated and is going to say, just forget it? So all of those things are really important in understanding what has happened over time that has shaped this particular behavior. Again, antecedent, what happened right before the behavior itself, which we define extremely carefully to make sure that we're actually catching what it is. And then the consequence of that behavior. What happens? I had a child that I worked with in the school environment, and he had learned that any time that they had a test, if he started throwing items and he threw his desk down on the floor and started screaming, the consequence of that was that he was sent to the front office. And he loved that because by going to the front office, he has now escaped the demand. And that was being done so often that it was extremely difficult to try to find a way to incrementally, slowly get him to sit there and actually engage and complete any work in this particular situation. So those are the types of things you see. Think about when you ask your child to go clean their room and they say, no, I'm not doing it. And they run upstairs and they, throw the door shut and they're crying and they're screaming. It's the same thing. Something there in that chain of ABC can be tweaked to make sure that we control the antecedents, how we ask, what we offer up front, the behavior itself, and then the consequence that follows. Understanding ABC behavior, understanding the ABCs in any behavior is what helps us figure out how to intervene and make positive behaviors come out of it and stop the negative behaviors. So your takeaway from this needs to be that nothing, that we cannot work on anything until we understand these ABCs of behavior. You could have, for example, this fascinating thing about antecedents, behavior, and consequence. I often give the example of a child that's eloping or running away from you. If that child is turning over and he's laughing as you're trying to chase him before, God forbid, he gets into the street, the function of that particular behavior, the reason he's doing it is clearly for attention. So the way I would go in to try to address that behavior would be very different from a child who's running away because he doesn't want to do it. Very doesn't want to do something that he's been asked to do. These are different, so our interventions are different. If you ever go through an ABA assessment with a BCBA and you start describing behaviors of children and what you're struggling with, that is what we're going to look at. And we're going to conduct a couple of assessments while we're in intake to determine the function of that behavior so we can best gear our intervention to address what you're seeing and what you're struggling with. So always remember these ABCs. Sometimes we ask parents to keep a little cheat sheet at home. And anytime there's a behavior, we ask the parents, just jot down real quick, what is it you asked the child to do? What did he do when you asked him to do that? And then what happened right afterwards? Because it helps us gain an understanding. Later on, as we go into the modules and we really dive into functions of behaviors, how that impacts everything, we'll talk a lot more about the nitty-gritty stuff of behaviors, how to identify what purpose they serve, and then how you as a parent can at home use tactics to help alleviate that behavior and have the child engage in more positive behaviors. Understanding why someone's doing what he's doing is so key in ABA, because every time we engage in any behavior, there is a function, there is a reason why we do what we do. And understanding that is at the core of being able to design a really specific intervention to that function and to be able to deal with that behavior. There are only 4 functions of behavior. When I first started in ABA over a decade ago, I came from a psychology background. And so that was really tough for me to buy at first. Like, you mean we're not trying to get to the root cause of why Johnny doesn't like to do his homework? Maybe it's because he didn't get the red fire truck when he turned 3. Those were the psychology type things going through my head. But the more I understood about the function of the behavior is regardless of the reason, right? There is a reason why this behavior is happening today. It serves a function for that person. So here are the 4 functions, and these are core to everything we do. The very first function is attention. This is where we do something to get someone else's attention. It could be something good, like we make all A's because we know we're going to make our parents very happy, or it could be something bad, like I'm going to bang my head against the wall because I know that if I do, I will immediately get the attention I seek from my parent. Again, these are all tied to understanding the function of why this child or why this person did what it did. And like I said, I'm talking specifically about children because I'm guessing most of you are here concerned about your children's behaviors. But again, this is for any of us. We all do something. Every behavior we do has a reason. So attention is one of those. The second one is escape. We don't want to do it. We absolutely are trying to avoid something that we don't want to do. We don't like it. And this I could really go into nitty gritty, but like I said, we're just looking at the big, broad perspective. But a really easy one is think of your alarm clock going in the morning. It hurts, it hurts your ears. It's waking you up. You're trying to escape that sound, so you turn it off. The function of you turning off that alarm is an escape from that noise that's aggravating. You call in sick because you just don't feel like going into work. You're not really sick. Again, you're escaping having to go to work and do something unpleasant. That escape behavior is always because you're trying to get away from something you don't want to do or you don't like. Children suffer a lot from escape functions of behavior, particularly when it comes to doing things they don't want to do, like academic tasks, chores around the house, things like that. So when you think of escape, think of that. I'm just trying to get away from doing it, so I'm going to do whatever I can not to have to do it. Access. Think of the child that's on the iPad and you're about to take their iPad from them. And now they're going to be terribly upset because they no longer have access to that desired item. Again, with access, you're not looking for attention. You're not looking to run away from it. You just want to continue to have access to it, or you want to be told at some point that you're going to regain access to it. So having access to something that you enjoy is what motivates the access function of behavior. Why do we go to work? We go to work because we get a paycheck, right? So that paycheck gives us access to buy the things that we want. When someone doesn't care about anything or wanting to purchase anything or want to pay their rent, they just don't care, that access is missing. So there would be a different function for their behavior. Sensory is what we call often like stimming behavior, and we all have these. A lot of times kids on the autism will stim a little more obvious than the rest of us. But I mean, I've been stimming already in this presentation. I do this, or sometimes I'll do this or play with my hair, and that's a self-soothing, automatically reinforced sensory thing for me. A lot of children on the spectrum will do their hands like this, or they'll flap their hand in front of their face, or they'll do some sort of repetitive movement. And that is an automatically reinforced. It's not coming from the outside. It just self-soothes them. And they do it because it's something that they can reinforce themselves as a behavior. We've done a lot of growth in our field when it comes to sensory type stimmings. We used to work really hard to reduce those. We wanted very much to stop a child from doing this. But what's happened through the years, as children on the spectrum have grown and matured, and now they can communicate, what was it like to receive ABA? What were the good things about ABA? What were the bad things? The one thing they always tell us is that having their stimming blocked, having someone block this when in fact it wasn't really interfering with anyone or anything, it was very traumatizing for them. So most BCBAs, myself included, we tend to stay away from putting targets in the intervention that are specifically directed to sensory automatic reinforcement type behavior. Another thing to think about when you're talking about automatic reinforcement or sensory type things, a lot of drug addictions, alcohol addictions are an example of a behavior that people engage in, and it's automatically reinforced. And that is why, in many ways, it's very difficult to find an alternate behavior, right, that's going to give them the same result, and why it is so hard. For example, if you have anyone in your family that struggles with any kind of addiction, you know how hard it is to overcome that. And it's mainly because it is a sensory, self-automated behavior function and a why of behavior. How do we build new skills? How do we take a child that's nonverbal and help him become verbal? Which, by the way, as a BCBA, is one of the most exciting things to see, is to have a child that doesn't speak and you have the parent tell me, I just want to hear my child's voice. And how do we do that? What can I do with his or her intervention that other people have been able to do? Well, it's reinforcing, which reinforcement means giving something to your child that he likes or she likes after engaging in a good behavior. So with a nonverbal child, we will encourage verbalizations, even if it's just making sounds at the beginning, even if it's just babbling, even if it's doing things like echoics, where they're just repeating a sound that they heard. We heavily encourage that because we want to make sure the child's starting to understand that making verbalizations is worth the effort. There's going to be something good that comes from it. So that's an example of reinforcing behavior that we want. When we reinforce behavior and we do it correctly, you know you're doing it correctly because the behavior that you want to increase will. A lot of times what happens, we reinforce, when I say we, I mean us as parents, right? We reinforce behavior, we give a reinforcement, for example, and then nothing happens. And then we're like, oh, they said reinforcement works. Why is it not working? Well, maybe it wasn't reinforcing to this child. A child that doesn't care about watching TV is not going to see 30-minute allowance on the TV as a reinforcer. It has to be very specific to that child. And the way you test that it works is you keep track to see, is the behavior I want to increase increasing as I'm delivering this reinforcer to the kiddo? Some kids will do a lot of things for just an M&M or a goldfish or a cracker. They'll be willing to make sounds and say words. They'll be willing to clean the area where they just ate in exchange for something like a small edible. Other children may do it for 2 additional minutes on the iPad. Other kids might do it just for 2 minutes out, 5 minutes on a gym equipment. So finding out what is considered a reinforcer for that kid is very important. And again, it's a reinforcer if it works in increasing the behaviors that you want. In this field, we do a lot of what's called preference assessment. And what that basically means is just because the child loved popcorn and worked for one piece of popcorn today while in ABA therapy, it may not work tomorrow. And that's okay because reinforcers change constantly. Praise stickers, extra playtime, all these other things are just examples of really powerful reinforcer. Think of a child that comes home and shows you that he got a sticker from the teacher and a check mark, and they're so proud. That is going to reinforce that child from doing that particular behavior. In other words, studying and doing well on an exam. Consistency is key. And in addition to consistency, if you promise that you're going to deliver a reinforcer for a particular behavior, it becomes very important that that part of the bargain is maintained, or you're going to lose that trust. And no matter what you offer, it's not going to happen. I worked with a child who was in high school. His mom promised him a new Nintendo 64. This was years back. And if he made all A's. And this kid did really well with this, even though, it was a very delayed gratification. I mean, he had to go through this whole semester and made all A's and went home all excited. He's going to get his Nintendo 64. And mom said, son, right now we're just not in a financial position to buy this game. And he didn't get it. Let me tell you, it was devastating to him. And it took a lot of work to have him even make B's the following semester. So never ever say, I'm going to deliver this to you if you do A, B, or C, and then not be able to deliver it. I tend to tell parents, stay away from big items, stay small, and stay with something that no matter how tired you are and life happened and interfered with your schedule, it's something that you can go ahead and deliver. How do you start reinforcing a behavior? Really easy. Catch your child doing something good, celebrate it. Celebrate it by doing something. It doesn't have to be super special. It could be just you sitting with them for 5 minutes and watching a Minecraft video if they're into that. Again, you want to pick a reinforcer that means a lot to them. For me, watching Minecraft would not be reinforcing, but for a kid who's into that, it means everything. So that is how we start building new skills. We always start small, baby steps. In the process, we're building that trust like, oh, wow, this person's actually going to deliver. Every time they say they're going to give me something, they're going to do it if I do my part. Very important to understand about reinforcement and understand that reinforcers are continuously changing. They never remain the same. What are some common myths about ABA? If you have Googled about ABA or you've had people talk to you about ABA, here are some things that you probably heard, that ABA is only for children with autism. And like I said before, that is just not true. Any human behavior can be altered and shaped and increase the positives while we decrease the negatives through ABA. These principles work for everyone because we're all human and we all have behavior. We all engage in behavior all the time. So it works across the board. ABA uses punishment. In fact, in all the clinics that I've worked over the years, we never use punishment. Punishment is interesting, right? Because it has an immediate effect and it's a powerful effect. But what happens in the long run, punishment ends to diminish and decrease in its potency. Think of spanking a child when they've done something bad, and then they do something bad again and they get spanked. Eventually, they're going to get conditioned where that spanking no longer bothers them, and it would have to be revved up to have the same effect that it had at the beginning. Positive reinforcement, on the other hand, will continue to grow and will continue to keep good behaviors, behaviors we want to see more of, go ahead and start increasing and continue to increase. All of the studies done in the last 20, 30 years have shown that although reinforcement is slower to work than the negative punishment, the positive reinforcement is going to maintain that behavior and increase the behavior a lot faster than punishing. ABA is rigid or robotic. I'm not sure where people are getting that. The fact is it is extremely flexible. It is extremely fun, and it's very individualized. When we bring a child into the clinic, it is imperative for us every single time they come there to make it a fun experience. I used to work in home, and if I ever felt when I got to that house and they opened the door that the child like ran away or didn't want to see me, I knew that I had work to do, because for some reason that child no longer associated me with fun and happy stuff. So it's very important to us to make it flexible, to make it fun, to make it individualized, so that that child enjoys coming to the clinic. He doesn't have to be, drug out of the car and brought into the clinic. He's like walking in there knowing that someone's going to be dedicated to him for several hours, doing nothing but interacting with them, and they don't even realize that they're learning. That's the key to really building those relationships with the children. And then we got to be very flexible. A lot of time kids come to us after they've been in school all day. They're tired. They may have had a bad day. We got to be able to immediately change how we do, change how we talk, and make sure we meet that child where they are in that moment. What is your role as a parent? I mean, parents are the most important thing in all of this. I used to have a professor when I was doing my postgraduate work that said that he never accepted any new client until he met with the parents first and made sure that they could collaborate as a team to have the success that he wanted to see children have. And honestly, that's optimal. If we can get collaboration between parents and therapists, and then hopefully add school into it, you've got a winning team. You are the most important teacher. Even when you're not teaching, you're teaching by modeling behavior. Everything you do, your child sees you. They're learning from you all the time. If you start using some of these strategies that I've already talked about, reinforcing good behavior whenever possible, making sure that you recognize behaviors that you want to increase, if you incorporate that in your daily routines, you will be amazed. In just a very small, short period of time, you're going to see those behaviors increase in frequency. Share all your observations with the ABA team. Reach out to your BCBA and say, hey, I tried this at home and it really worked. BCBAs will be so excited to be able to incorporate whatever you found out at home into our intervention in the clinic or in the school. It is very important to stay as consistent as possible between environments so that that child is very clear on the fact that he's being reinforced for this behavior, no matter which environment it happens in. Again, small, steady step. I call them baby steps. And I used to get very greedy when I work one-on-one with children where I wanted them to do more and more and more. But you got to be careful. Just take small steps, celebrate every win. Every step that you make at home that ends up being a winner, go ahead and do it. There are a lot of strategies that you can use, and we'll delve into those as we go through these modules. But a very, very simple one with a little bit older kids, using short-term contracts. If you do A, you will get B. You will be amazed how well that works. Now, I have had parents tell me, I just want my kid to do it. I don't want him to do it because I'm going to give him 5 minutes on the iPad. And my joke always back to the parent is, how would you feel if your boss said, I just want you to come to work, but I'm not going to pay you? It's the same thing. Think of that. The reinforcer there is so powerful that this child is going to be able or willing to do something he normally doesn't want to do for what he has been promised upon completion. Again, small, steady steps, baby steps, consistency. We want your child to use new skills everywhere. And like I mentioned before in passing, generalization to what we do is very important. If a child only does it when I'm there, then that skill has not been learned. it has to generalize to mom and dad. It has to generalize to school. It has to generalize when you go to Walmart. So it is very important that we as a team work together to generalize those behaviors. And we practice this in different settings. We practice with different people. We practice this during routines. One of the plus things of ABA in a clinic versus in home, based on my experience, is that in a clinic, the child's more likely to work with a lot more than just one or two dedicated techs. He will come in and have different schedules. The good thing, sometimes parents get confused about that. Well, I want the same tech every time, which I understand why they do, but for generalization purposes, the more different people they work with, the faster generalization of the skill is going to happen. So that's why practicing in different settings with different people is so very important. And anytime, a child in a natural environment, in the environment that they are in, anytime that something happens that's good, reinforce those learned behaviors. Say, oh my gosh, I can't believe you did the whole worksheet. That's amazing. You've completed the whole math thing. Wow, that is so cool. And then deliver some sort of reinforcer in addition to the verbal praise. Ultimately, what we want to do as this child builds their repertoire of behaviors, positive behaviors, is we want that child to get to the point to where the reinforcer occurs naturally, and it's not something that we're manipulating. It's no longer a goldfish. It's no longer 5 extra minutes on the iPad, but he will thrive or she will thrive on just verbal praise alone, because verbal praise most of the time is available in their natural environment. The teachers will praise good behavior. So once we get to that point, we can fade away all the other contrived reinforcers and really, really get that child to shine based on nothing but great job, Johnny, and that'll be enough. Practice new skills with a child in real life moments, while you're eating dinner, while you're playing, while you're going to run errands. It was so easy to tell a child, if I used to do this with my own children, we'll pull up to Walmart. I have 4 kids, so all these kids, and I would be like, okay, here's what's going to happen. When we go inside, if all of you stay near the cart and walk with me, when we get done, each one of you can pick a toy for less than $3. And it worked every time until they got a little bit older and then they wanted more than $3. But in the beginning, that first step. And by doing that, I've also taught them that I will deliver on my promise. And I also taught them this idea of do this and this will be reinforced. So it continued to work, continued to work even as they got older. Everything we do in ABA, as opposed to other fields, like particularly psychology from where I come, is we take data during every session. Our techs are highly trained to take data. And when that BCBA drops in on 20% of the sessions that this tech has, that's the first thing we look at. Where are we with the data? Are we seeing growth? Are we seeing that this child went from 0 to maybe now they're at 10%? Are we seeing a decrease in negative behaviors? Maybe I work with children that tantrumed as much as 100 times during a session. And if I'm not seeing that 100 come down as each session progresses, I know that my intervention needs to be changed. It needs to be tweaked. I'm not doing something right. So everything's in graphs. A child that's in ABA, for example, every 3 to 6 months, depending on insurances, will have what's called a reassessment. And during that reassessment, and we share this with the parents, they actually get to see the graph of every single behavior that we've targeted during that time. And you get to see, is it going up? Is it going down? And then you will see an explanation from the BCBA as to why do these numbers look like they do. So there is a graph for every behavior. At any one time, if your child is in ABA, you wanted to reach out to the BCBA and say, hey, how's he doing on such and such? That BCBA will be able to immediately pull that up and share it with you and say, okay, look at this. Look how great he's doing. Look, we're in the 50 percentile, upper percentile of the graph when we started from 0. So everything is very, very carefully tracked. Data that we take helps us celebrate how far your child has come. If your child was tantruming every single time he was asked to do a less preferred task, and now he's only tantruming once a week, that's a huge gain. Huge gain. So those are the reasons why we track everything the way we do. If you've ever been in an ABA clinic, majority of them now use iPads. We used to use paper, but now we use iPads, and you will see that they are constantly looking and pushing buttons because they're tracking that behavior and they're making sure that they're supplying the BCBA with the data for every behavior targeted. Data shows patterns, it shows progress, it shows where do we need to go next. You can also see, even as a parent, you will see progress without keeping track at home, but you will see it in their everyday interactions with you. You will see it in their communication, in their life skills, independence, and their overall confidence. Kids like ultimately doing well and being reinforced. Tapping into that is vital. Again, teamwork between parents, techs, BCBAs, school, community organizations, sports teams, all of that makes a difference in every child's life. Open communication between everyone. Most of the time, we collaborate with speech therapists, occupational therapists, physical therapists, sometimes trauma therapists, all come together to look at this one child's needs, one child's deficiencies, and where we're trying to get with that child, and make sure that all of our interventions are aligned to get where we need to go. Maybe that child is struggling with math because he's missed a few blocks, and now he's finding himself in fourth or fifth grade, and he hasn't even mastered adding two-digit numbers. So it's important for us to understand realistically, where is this kid and what can we do to catch him up on this one-on-one work that we do with them. Most of the time, insurance companies give us some leeway when it comes to academic tasks because we can use academic task work to work on attending to less preferred task. By definition, academic work is a less preferred task for most children. So we can, if you come to us and you say, hey, he's got this worksheet, he will not even touch it at home, I'm too tired to deal with it, can you help him? Most of the time, we can work it in to where we're going to work on attending to less preferred skill task while he or she is in therapy. It's very important to have open communication, make sure that we're all on the same page. Speech therapists who work with children that are struggling with communication, them having the same targets that we have, and we can reinforce each other and help each other get to where we need to go. That is very important. Consistency, growth happens faster, all because of this team effort. I can tell you, I don't have a company phone, I have a personal phone. Every parent that I've ever worked with is in my phone, and they've never, I've never gotten upset when they reach out and ask me questions. And you will find that most BBCBAs are very committed to this field and will not mind you reaching out and saying, hey, I'm really struggling with this. What can we do? And sometimes we'll meet with you face to face, or we'll talk on the phone, or we'll try to figure something out. Ask questions. Don't be afraid to say, why are we working on this? And they'll explain it to you. And once they explain it to you, make a lot more sense than it did when you just first looked at it. Share success, stay involved. You're absolutely part of the team. If you've ever seen one of the plans that we write for the children, we have an entire section that's dedicated on parent collaboration, working with parents on certain goals. Some parents will come and say, hey, teach me how to do a short-term contract. Teach me about this thing I hear called PREMAC principle, which basically is first this, then that. Teach me how to work on these things, and we will more than happy do that. Most insurance companies will even cover what they call parent training or caregiver training. They will cover the time that we spend with you trying to help you implement what's working in the clinic. I had a parent reach out to me the other day that their child threw a tantrum in school because she wanted to go home and she was told no. She just could not accept the no, and that tantrum lasted for well over 30 minutes. You're talking about a child in crisis for over 30 minutes. So parent reached out, what can we do? So I gave her all of the information of what had worked in the clinic. She was able to go to the teacher and say, hey, can we try this? The teacher agreed. And so the next time the child asked to go home, the child was shown a visual timer of how much time there was left before she could go home, and it worked. It worked because we had been doing it in clinic all along. And she accepted that, okay, I can, it's a really smart little girl. I can see that I've got 2 hours and 30 minutes left, so I'm okay. I'm okay. I know it's going to end. And they've explained it to me. That's all it took. Will that work for every child? No. Some children may look at that timer and go, what? I got 2 more hours. Blah. But if you understand the function of the behavior, we can work with that. And for her, it was just knowing that it was going to end, and she wanted to stay informed of how much more time she had. It's just one of gazillion examples of how teamwork can make a difference in any environment. Review your child's treatment goals with your BCBA. Again, I've talked about this ad nauseum, I think, about how important it is to be part of the team and how much we as BCBAs thrive on having you part of the team and sharing information with us, telling us what's going on at home. Practice simple reinforcement strategies at home. For now, for most kids, not everyone, but for most kids, just getting 5 minutes of TV or 5 minutes of iPad, they are willing to do a lot more than you realize for just a little bit of that. Edible reinforcers like goldfish, different things like that also work. They're very powerful because it's what we call a primary reinforcer because it's food. For older children, you have what's called secondary reinforcers, where you give them $1 and then they can, with that dollar, get what they want. All of these are powerful, powerful reinforcers. We just have to determine exactly what would work for your child and what has the most power to shape their behavior. Remember that progress takes work. ABA requires a lot of commitment, for a lot of time, requires quite a few hours as compared to other therapies, because takes time to progress. It gets time to condition a child to do things that they've never wanted to do before, or to stop doing things that they've been doing for a long time and been able to use to their advantage. I could talk forever on how self-injurious behaviors develop, why they develop, and how to stop those behaviors. I could talk forever about children who don't want to do their homework and so on, and the things that we can do to help with that. This module is meant to just kind of give you an overview of how it works, why it works, how is it tied to behavior functions, and so forth. Celebrate the small wins along the way. You will not um, you will not hurt your child by over celebrating their wins. If anything, it's going to make them feel very special, and it's going to make them want to recreate that joy that they created in you. Most children want to make their parents happy, just as most parents want to make their children happy. So it's there to tap into. It's just a question of trying to figure out exactly what works best for this particular child, and that's where we can come in. A consistency, stay positive, celebrate the progress, and you will be amazed at how, it snowballs a little bit at a time. You're constantly building. Since I've been with Gate, I think I joined the team in August of last year. The gains that I've seen the children make in that clinic, in addition to all my experiences in other states, it is remarkable. We had a little girl that a year ago could not say any words at all, no sounds. And she was able to graduate and move on to pre-K and is talking in full sentences. And I just checked in with mom to make sure she was doing okay, and she's doing great. So these are real stories. These are your friends and neighbors, real stories of just tremendous gains made. I will say that the younger the child, the quicker we are able to see these really amazing and drastic gains. As children get older, it gets a little bit tougher, but that doesn't mean it can't be done. My advice to you would be that if you have a child that's been diagnosed, or you suspect that they could be diagnosed on the spectrum, to try to get them into therapy as quickly and as soon as possible rather than waiting. The more you wait, the more they've been conditioned, and it's going to be some reconditioning involved. This little girl I was telling you about, when she came to us, she was about 2.5. So now she's like in pre-K. So it's, the earlier we can get in there and really work with them, the better. So I've covered a lot. I know I talk a little bit fast, but I want you to really have a moment and think to yourself, like, what is a strategy that I would like to implement at home this week? Maybe you like the idea of a short-term contract, especially if you have an older child. Maybe you like an idea of first do this, then we can do that. That's called the PREMAC principle. It works beautifully. I only had one child in my entire experience, only one child that it didn't work with. He just shut down when he heard what was going to be available, and he just absolutely, that was it for him. I just want it now. I don't want to do anything for it. I want it now. But he's been the only kid out of hundreds that's actually shut down on that. Most of the time, if you say, go clean your room and then we can go do this. Let's finish 2 questions on this worksheet and then we'll take a break and do this and then we'll do the other 2. These are all things that you can try tonight, tomorrow, to see what kind of result you're seeing. Think about when and how you'll use it or for what particular behavior that you want to see increase. Once if you decide to pursue ABA practices, then make sure you tell the BCBA, hey, you know what? I tried giving him a goldfish for every question that he responded on his homework, and it worked beautifully. That helps us tremendously. Instead of starting from not knowing at all what's going to work for that kid, we're starting from a point where we know, oh, okay. So a primary reinforcer, such as food, is very powerful for this kid. Again, keep in mind that reinforcers are constantly changing. I tell techs when I work with them, think of behavior like a scale. This is what's required for me to do something. This is the effort required, and this is the reinforcer. These things have to always be balanced, right? Because if I suddenly feel like my effort is up here, but my reinforcer is down here, I'm not going to want to do it anymore. In adult terms, imagine taking a job for $10 an hour and you're so excited because you were jobless for the last few months, but then you find out that they actually want you to dig trenches 8 hours a day. And now you're digging trenches at $10 an hour. At some point, you're going to be like, you know what? I'm not putting this kind of effort in for $10. So that balance has to constantly be adjusted. Sometimes with some children, it's from 15 minutes to 15 minutes that we find that we have to readjust that balance. So the options you have when you go home and you try to do some reinforcement, you can either lower the cost that's involved on your child's side or up that reinforcer, but make sure that balance is straight. All right, I am going to get out of the this, and I am going to look at some of the Q&As and hopefully be able to respond to some of them. We still have a little bit of time left. Okay, so one of the questions is, as a parent, should I involve close family members in my child's ABA treatment? It depends, but my overall answer would be yes, because if you are reinforcing a particular behavior and then your child goes away for the weekend with a grandparent, you want that grandparent to reinforce that same behavior. If they don't, it's okay. It's not the end of the world because the child is still going to associate you with that reinforcer. Like, okay, if I do this for mom, mom is going to go ahead and reinforce me. And grandma's not, and that's okay. There's not going to be regression or loss of skill just because the family member doesn't want to be involved. But the more you have people on the team, the more you have a group approach to working with this child, the better off you are. This has been a joy to present to you. I always love talking about ABA, and I could talk about ABA for hours. I look forward to next month and doing this all over again on a whole different module. If you want to reach out to me, I'm at Gate and Gillette. So I look forward to hearing from you. And if you want to offer me some feedback on the presentation, I'm good with that too. I like reinforcement as well. I hope you guys have a wonderful evening and thank you so much for joining me. Bye.